talk to you a little bit about running injuries. We see a lot of runners come in here. Sometimes we see runners come in here with a specific pain for hip or knee or foot or even back pain that they feel when they're running. And sometimes people come in to see us for running because they want to become more efficient runners. And so there are a handful of us at OSI, myself included, that see people for running specialty issues. In general, there's a certain umbrella that people fall under with certain norms that we want to see for people when they're running. Most of the time though, when we see people come in for running injuries, their cadence is off. Very likely their core is not as strong as it's supposed to be, their pelvis might not be aligned correctly, and really their hip, their glute, and their hamstring is sick. Most of the time I see people with significant weakness there. And so what I tend to do, the philosophy that I have, is that I kind of take people apart. I work on those specific form issues, I work on their specific strength issues and build them up so that then we can put people on the treadmill and look and see how they look when they're running. So we'll actually videotape you. We look at you from top to bottom, from the back, from the side, from the front, and are you falling under that umbrella of norms, or where are you falling outside of the norm? And take those strength or whatever issues that we're improving, and now let's put you at real speed, and how do we need to make you better at your running speed so that you can, whether it be running a marathon or you're just running a 5K, what are your goals that you want to get back to, and look at you specifically and how we need to get you better. So how we treat that is, again, depending on whether you're coming in here with pain and you're seen in physical therapy for a specific pain, or sometimes we have people come in and they're here just for one visit to do a running evaluation where we can give you some suggestions for you to work on. I personally don't like to see people for one visit because those suggestions that I give you, I want to make sure that I can follow up with you and see how things are progressing or not, and what else we need to do with you to make you the kind of runner that you want to be. So the number of visits that you might see me for a running evaluation or a running injury really varies. It could be as little as 1 or 2, or if you're here for pain, we might see you maybe 8 times for things like IT band tendonitis, Achilles tendonitis, hip pain, or some kind of back pain that might be coming from a lack of proper form or strength with your running. Your expectation should be that you get better, that you resolve the pain that you may be having, and that you tend to improve your running, your efficiency, your cadence, perhaps better time. But your expectation when you come in to see me for a running evaluation should be that you get better, and that the goals that you're setting and that we talk about together, that you improve with that. I would invite you, if you have any questions about this, to schedule a free phone consultation.